So, last time we spoke about how feelings aren't just reactions to what happens, but something shaped by the meaning we give those moments. And I've been thinking about one feeling in particular, one that we are often told to move past quickly, to fix, to brighten, to not dwell on. Yes, that's sadness. Welcome to the Thoughtful Doctor, where medicine meets humanity. Now, sadness is interesting. Not because it feels good, it doesn't, but because of what we have decided it means. We treat sadness as if it gets in the way, as if it makes us weak or irrational, or maybe less able to function. And I do understand why. I'm a GP, I see almost 30-40 patients a day. I've got twin boys who need feeding, managing, and somehow both need exactly the same thing at exactly the wrong moment. I know what it's like to feel the pressure to keep going, to stay productive, to not let things slow us down. But I think we have got this one wrong. Because sadness isn't the opposite of thinking clearly. It might actually be part of how we think well. Now, there's research, quite a lot of it actually, that shows that when we feel sad, our thinking changes. It becomes slower, it becomes more careful, more reflective. And sometimes that can be really useful. So, Joseph Forgas, an Australian psychologist, did some fascinating work on this. He found that people in mildly sad moods were better at certain tasks. They paid more attention to detail, they were less likely to jump to conclusions, less susceptible to stereotypes, and more accurate in their memories. So, sadness, it turns out, makes us think more carefully. Now, that doesn't mean sadness feels pleasant, because it doesn't. It's uncomfortable. Sometimes it's heavy. But uncomfortable doesn't mean useless. Think about it like this. Pain is our body's way of saying, something's wrong here, pay attention. And sadness, it's the mind's way of saying the same thing. It's the signal, a request for our attention. Maybe it's saying that this loss matters to you, or this situation isn't working. Or something like, you have been running too fast for too long, and something important is being left behind. Now, when patients come in and say to me, I just feel sad and I don't know why, my first question isn't, how do we make it stop? It's, what is the sadness about? Because often, not always, but often, the sadness knows something we have been trying not to know. I remember this one patient saying to me, I feel ridiculous for being upset about this. And the more we talked, the clearer it became that the sadness wasn't ridiculous at all. It was grief. Grief for a version of life they thought they would have by now. And I think that's the part of why this matters. Because we have been taught to relate to emotions in a very strange way. We live in a culture obsessed with optimization, productivity, efficiency, positive vibes only. And we have started treating emotions, especially the uncomfortable ones, like they're bugs in the system. Sadness, that's a glitch. Anxiety, that's an error message. Grief, system failure. We pathologize them, medicate them, hustle past them. And I say this as someone who prescribes antidepressants, who absolutely believes in their value when needed. We got to stop treating every difficult emotion like it's a problem to be solved. Because emotions are not the opposite of thinking, they are thinking. They help our brain decide what matters, what needs attention, what needs care. So, here's what I've noticed in my own life. The times I have tried to outrun sadness, to busy myself, distract myself, and stay positive, those are the times I have made my worst decisions. I've said yes to things I should have said no to. I have missed what my kids were actually trying to tell me. I've ignored my own limits until I've crashed. But when I have allowed myself to sit with that sadness, even just for 10 minutes with a cup of coffee and no distractions, that's when clarity comes. Not always immediately, not in some Hollywood epiphany moment, but slowly, carefully. Because sadness makes me ask better questions about How does this hurt? Why does this hurt? What do I actually need right now? What am I grieving, and what does that tell me about what I value? Because between what happens and what we feel, there's something in the middle, the meaning we give it. And the sadness is often asking us to look at that meaning more closely, not to wallow, not to get stuck, but to understand, to notice what matters, to slow down enough to see what we have been moving too fast to catch. But there's something important I need to say at this point. There's a difference between sadness and clinical depression. Where sadness is responsive, it has a reason. Even if you don't immediately know what that is, it ebbs and flows. It allows moments of other feelings like relief, connection, even small joys. But depression is different. Depression is persistent, pervasive. It flattens everything. It can make you feel like nothing matters, nothing will change, and that you won't change either. It affects sleep, appetite, energy. It makes even small tasks feel impossible. So if you're listening to this and thinking, I haven't felt anything but sad for weeks and I can't see a way forward, please talk to someone, your GP, a therapist, a trusted friend. Because that's not the kind of sadness I am talking about today. That needs proper support. But for the rest of us, sitting with ordinary human sadness, that's not pathology, that's being alive. And here's the complicated bit. You can experience healthy, meaningful sadness and have clinical depression because they are not mutually exclusive. So if you are on antidepressants and still feel sad sometimes, that's normal. The medication isn't meant to erase all the difficult feelings. It's meant to help you have the capacity to feel them without being consumed by them. So maybe sadness isn't always something to get rid of. Maybe sometimes sadness is asking us to slow down and look more honestly at what is happening. Not forever, not to drown in it, but to listen to what it's trying to show us. So before we finish, a small thoughtful doctor prescription for the week. The next time you feel sad, instead of immediately trying to fix it or push it away, pause just for a moment and ask, what is this sadness trying to show me? Not to solve it, not to make it go away, just to listen. Because often, sadness isn't the problem. It's the signal that something needs our attention. And sometimes giving it that attention is enough to create that space. So let's take a slow breath in and a gentle breath out. And hold this thought lightly. Maybe sadness isn't weakness. Maybe it's one of the most honest things our minds can do. Maybe sadness has its own kind of intelligence. So until next time, we are not failing. We are just learning something we have never been taught or we have never thought. Because the world moves fast, but understanding people and minds take time. So thank you and take care.